G'day everyone, this is Health Highlights, a show about health professionals and the stories and the people behind the names that we hear about but we seldom get to meet. And today we have got an absolute stunner for you. This is going to be amazing. We're going to get to go into a theatre and check it all out. And we've got Dr.Jai Kumar here with us today. He's going to give us a tour. Welcome, Jai.
Hi Simon, how are you?
Very good, thank you. So Jai, tell us a little bit about what we're going to see today.
So we're here at Lingard Private Hospital in Merriweather, where I do most of all my private operating. It's a large 7-theatre complex which is about to expand. It specialises in all kinds of surgery, but specifically quite a lot of orthopaedic surgery. We're here in Theatre 6, which is one of my regular theatres, and it just gives you an opportunity to have a look at the theatre process and see the process of a patient coming through in the anaesthetic bay and into the theatre, and give you appreciation of some of the equipment we have in the theatres here. Technology from a medical point of view changes by the hour, by the minute these days, and it's so hard for us as medical professionals and other healthcare professionals to try and keep up with it. So for you to get a snapshot of what's happening right now in modern day surgery is fantastic.
Awesome. So we're going to go behind the curtain and check out what doctors get up to. So let's go.
Welcome everyone to Theatre 6 at Lingard Private. We're going to try and take you through a step-by-step process of what a patient goes through. So here is the entrance doors to the anaesthetic bay. So come on in.
Okay, so here we are. This is the anaesthetics bay.
So this is where the patient gets wheeled into the anaesthetic bay and gets assessed by the anaesthetist. And the anaesthetist probably has the most important job of all. They're responsible for keeping a patient alive while we do the operation. So in this area, the anaesthetist has a consultation with the patient and talks about their past medical history, figures out what their allergies are and how they've gone with surgery in the past. And then based on that determines what kind of anaesthetic they give, whether they require antibiotics, what kind of post-operative pain relief they need. And it all happens here in the quiet environment of the anaesthetic bay. Around us here we have multiple medications, and for example this here is a drug-giving device, and here we have a sphygmomanometer which monitors blood pressure. The anaesthetist, before the patient crosses the threshold into theatre, really needs to know everything about the patient. So if there's any issues that occur at any stage during the procedure, they can act swiftly and make sure the patient comes out with a safe outcome. It's probably the scariest part for a lot of patients because this is where the cannula goes in. So if you don't like needles, this is the place where you've got to put up with that first needle. And once you've got that needle in, then they can give most of the intravenous medications from there.
So now we've got a few of those implements that they use during the surgery. So Jai, can you just talk us through what we've got in here?
Yeah,
it looks pretty funky.
Yeah, so this is what we call a shoulder tray, and this is all the equipment we use to do our arthroscopic shoulder surgery. And as you can appreciate, there's lots of handles and lots of long, thin sort of pincer-like implements that allow us to reach deep inside the shoulder. The beauty of this equipment is that when we put a camera inside a shoulder, we've got the camera in and we've got to reach into a small space. We can't just go and grab stuff and pull it out. So along here we have, these are suture passes, and you can see it's got a hook and a little bite. And what that allows me to do is reach in and grab stitches and then pull them out, pass them around, label them, pass them around rotator cuff, and do a lot of the work that usually my hands would do inside the shoulder. So the best way to think of these are extensions of a human being's hand. The same goes with this equipment. This is an arthroscopic grabber, which again allows me to reach deep into the shoulder joint, and while I'm viewing on the computer screen I can reach down, grab different materials and sutures and pull them out. This here is an arthroscopic cutter, which is like a pair of scissors on the end of a pincher, and what that enables me to do is to slide this down a suture and cut a suture rather than have to reach in with a pair of scissors, which is very difficult to do through a 8mm hole. This is one of our commercially available suture passing devices. This is the one that I use, called the First Pass, which is designed by a company called Smith & Nephew. And what this allows me to do is to reach in and grab a piece of rotator cuff and pass sutures through the rotator cuff. And again, this is all done with keyhole or arthroscopic surgery. And the rest of this equipment are small punches which allow me to put holes in the bone so we can then put anchors in. So when we do, say for example, a rotator cuff repair, we're taking a torn bit of muscle or tendon off a bone, and we're essentially planting it back onto where it came from. And planting it and holding it there is essentially a scaffolding process. We're holding the tendon in place while the body heals it. And so all the anchors and sutures we use are responsible for that scaffolding and holding things in position. And then we rely on the body to heal it before we start really pushing things. So all the equipment now is basically been designed to be an extension of a human being's hand. And all of our fine motor skills, we can never quite replicate the fine motor skills that a human hand can achieve, but this is the closest we've got to it.
Amazing.
Yeah,
Amazing.
so and the real focus is on trying to reduce the amount of tissue trauma, increase the visibility inside a shoulder joint or a knee joint, and therefore improve the patient outcome.
That's fantastic. Thanks, Jai.
No worries.
Okay, so here we are. We've gone behind the curtain, or actually in a theatre right now. So Jai, can you just give us a run through of all this amazing equipment that we're looking at?
Yeah, so this here is a standard modern operating theatre at Lingard Private. It's larger than average, and it enables people like orthopaedic surgeons who have a lot of equipment, plenty of space to do their work whilst maintaining a sterile environment. So obviously the centrepiece is the bed, it's where the patient is, and most of the equipment is built around the bed. So if you look over here, this piece of machinery here is the Anaesthetic Machine, and that allows us, the anaesthetist, to monitor blood pressure, heart rate, oxygenation, and give various medications to make sure the patient's safe throughout the procedure. Just to the right over here is where most of my arthroscopic equipment sits, and that allows me to have shavers, burrs, allow water flow in and out of a shoulder or a knee while I'm doing a procedure, and essentially modernises what previously used to be handheld pumps and more archaic ways of looking into knees and shoulders. This particular piece of kit here is called a spider arm, and this has revolutionised the way I do my shoulder surgery. So historically, the poor old assistant or the fellow or whoever was assisting the surgeon would be sitting there holding an arm for hours on end and twisting and turning it. Now we have equipment like this, which is a hydraulic arm, which, as you can see, I can swing on, but if I push a foot pedal, I can place this positioner in any position I want, and the same thing happens. So it actually acts as a third arm in the operating theatre. And when I'm manipulating a shoulder around to get a view of a labrum or a rotator cuff tear, it gives me the best ability to be able to achieve that. The key to the operating theatre space is cleanliness and also sterility, and obviously an ability to move around. If we're doing a knee replacement, you can have anywhere from 10 to 15 trays open, and all those trays have to be sterile, they have to give you plenty of space for all the staff to move around, and also for reps, anaesthetists, anaesthetic nurses. So at any one time there can be 5 or 10 people in an operating theatre, and although this room's large, once you pour all those people in there and all the equipment and the patients, it can become quite a busy environment. So we're a big family here, I guess, because we spend so many hours sort of squashed in with each other.
So are you in charge of that whole team? Or is there a few different people?
It's a good point, because historically the surgeon was always seen as the person that was in charge, but definitely, at least in my theatre, it's more a team environment. I see us all as cogs in a wheel, and if one of those cogs is missing, the whole construct falls apart. So everyone from my operations assistant Kyle through to my scrub nurses, the reps, the anaesthetic nurses, the anaesthetist, the surgeon, we're all intimately involved. And that not only is here in the surgical environment, it also carries over into the rehab of the patient, where a team-based approach to total patient management is far different to what we're used to seeing. So historically, the surgeon would sit in their little glass castle and say, this is what I'm going to do and this is how I'm going to do it. It's now changing, and now I say to most of my patients, 20% is the surgery, 80% is the hard work that the patient puts in with their other allied healthcare providers. So, and that certainly has a huge impact on the way a patient feels about their process of surgery and the outcomes they get.
Brilliant. Now the other thing is we're in here and there's TV cameras everywhere.
Yes.
So can you explain why there are so many TV cameras
Exactly.
in this room?
So my subspecialty interest is arthroscopic sports surgery, which arthroscopic basically means keyhole surgery, and for me it's largely shoulders and knees. Historically we used to cut open joints and put anchors and screws and stitches and all those kind of things in. These days we use tiny little portals and we look into the shoulder or look into the knee and use these computer screens to view all of the information via a tiny camera. It's useful in a lot of ways because it's less invasive for the patient, but also it allows the rest of the staff to see what's going on in the shoulder joint or the knee joint. So with these 3 screens, I can be focusing on one screen while my assistant focuses on another, and I might have some other representatives in the theatre that want to view a big TV screen. They've got a huge screen over here that they can view all the surgery. Arthroscopic surgery has come a long way over the years, and it's certainly something that's seen as a mainstay these days. With my young active sporting population, it's basically all we do.
Yes.
All we do now. Means a lot more equipment in the theatre, but in terms of seeing what we need to see and having other people around us appreciate what's going on, it's fantastic. It's also good for documentation for us as well, because we can take photos and videos of everything that's going on. If patients have any doubts or concerns, we can explain it in terms of real pictures rather than saying, oh, this is what I did or this is what I cut and I think it went all right.
Yeah, wow, that's fantastic. So, there you have it. You've had an opportunity to step behind the curtain and have a bit of a look at what goes on in those operations. So thank you so much, Jai. It has been an absolute pleasure to have you as a part of our show and to give us such incredible access here at Lingard Hospital.
It's been great having you in here, and as I said to you, if any of your therapists or any physiotherapists want to stick their head in and have a look, the door's always open to see the surgery. It changes your perception of what happens in a patient process rather than just seeing a scar on a knee or a hole in a shoulder. To follow a patient through that whole process gives you a far better appreciation of what actually goes on from start to finish.
Absolutely, absolutely. Well, so thank you very much.
Pleasure.
Look, thank you for joining us. Have a great week. We've got an amazing interview coming up for you next week. We'll be interviewing Healthful Pantry, which is a store in Warners Bay that has organic food and produce. An amazing story behind the business. So join us, 12:30, same time, Wednesday, and have a fantastic week. Remember, healing is a gift, health a responsibility. See you later.